Okay. Good afternoon, everyone. I want to welcome you and also thank you for joining us for this event this afternoon. We are giving this statement at this venue today, and truly I remember KICC as being a place teeming with activity and people. So upon arriving here, I expected the same, forgetting that we are in the pandemic era and things have changed. Anyway, we're here today because we also want to commemorate a very important event in our calendar that we are kicking off today. And this is the World Blood Donor Day, which is going to be on Sunday, this Sunday. But we have already begun the campaign, and this is part of that campaign. So we are here today to bring support to our national blood transfusion services, and also to remind ourselves that although as a ministry we have been focusing over the last 3 months or so mostly on coronavirus, as a ministry we have a much larger mandate and a much larger responsibility to the citizens of this country in ensuring that we are able to provide the necessary services for health care. Blood, of course, is a very important component for health care, and I'm very happy that today we are here to launch off this blood donation campaign. This event is to mark, as I said earlier, the commencement of the blood donation campaign as we prepare for the World Blood Donor Day, which will be commemorated on Sunday, 14th June 2020. We are, as a country, with our population of approximately 50 million, the WHO recommendations for the level of blood that we should be stocking or collecting within a year, at a minimum, is 1% of our population. That is around 500,000 pints of blood a year. That translates to collecting about 1,370 pints of blood every day for us to have sufficient stocks of blood to last us for a year, according to the minimum amount that we must have. However, we have had challenges in our blood collection, and we have been recording about a collection of about 164,000 pints a year over the last couple of years, which translates to around 450 pints a day. So you can see we are far short of the minimum that we should be doing, and there is a need for us to work towards achieving that minimum. With the COVID pandemic, as has been seen globally in many other areas, many other parts of the world, because of the restrictions and the containment measures that have been put in place to combat COVID-19, it has been recorded that those seeking health care have also gone down. The rate of people going to hospitals for care and for other services has gone down because of this abnormal situation. And this is something that is not unique to our country, but has been recorded everywhere else. If we look at blood collection during this period of the pandemic, it is estimated that between 70 and 80%, there has been between a 70 and 80% drop in blood collection during this pandemic year times in many parts of the world. We in Kenya have recorded a drop from the 450 pints a day to about 250 pints a day. So the launch of this campaign is extremely important because we need to increase the number of pints that we collect in a day. And you will all are very well aware that we have faced challenges as far as our national blood transfusion services is concerned. Challenges that as a ministry we are diligently addressing in order to improve service delivery in this sector. Recognizing the need for additional investments in this sector, the government has initiated a number of programs to be able to build up the capacity of the Kenya National Blood Transfusion Services. We have increased the number of human resources within this facility by posting an additional 22 members of staff to the Kenya National Blood Transfusion Services. We have also arranged for additional resourcing of this facility, and we will be pumping in about 1 billion Kenya shillings through a World Bank program in the coming months to upgrade and improve the level of services, the level of blood collection within all the satellite sites and sites that collect blood under the Kenya National Blood Transfusion Services throughout the country, to ensure that we have enough commodities that are required for blood collection, that is the blood bags, and everything else that is required for that supply chain, and also to ensure that we have the right equipment and reagents that are required in the lab to ensure that the blood we collect is properly handled, processed, and is safe for transfusion to patients. So that is ongoing work, and we, including, as I should add to, including looking at the governance structure of this very important service sector with a view of improving that through legislation so that the National Blood Transfusion Services can become a semi-autonomous agency that will be able to function with some level of autonomy and hopefully effectiveness and efficiency. These are all plans that are in the works, and I'm sure that in the next coming months we should see some activities in that area, even though the COVID-19 pandemic situation, of course, as you will all agree, has slowed down a number of activities. So, ladies and gentlemen, as part of effort to appeal to our people to volunteer and donate blood, we have also collaborated with partners, leveraging on the importance and utility of ICT in service delivery. We have collaborated with Facebook, for example, and Dow Sasa Systems, who use their ICT platforms to mobilize blood donors for the next 2 blood donors for blood donation campaigns such as this one. For this particular campaign, I can tell you that as of this morning, about 12,779 individuals in the country had set reminders on their Facebook accounts to come out and donate blood countrywide. There are also 33 other centers countrywide where this same exercise that we are conducting here today is also being carried out. Another 1,522 people who have called various centers to book an appointment for blood donation are expected also to present themselves and donate blood at these centers. We want to appeal to those inquiring and making pledges, as well as other well-wishers, to come forward and participate in this very important activity. Must also acknowledge, say that we are grateful to our partners and sponsors who have extended their hand of support in this venture. We want to express our appreciation to the Kenyatta International Conference Center management team for allowing us to use these wonderful grounds for this campaign, the Standard Group, Dawa Sasa Systems, UNFPA, AMREF, Farm Access, Kenyatta National Hospital, and Coca-Cola, who have all played a part in organizing this drive.